At the start of the pandemic, the overall consensus was that older patients are more vulnerable to COVID-19 and children are not as affected. But that conclusion is being tested by the highly infectious Omicron variant. Health officials expressed concern that hospitalizations in the state have topped 5,500 for the first time since late February, and the number of children testing positive for COVID has also shot up in recent days.
Many people continue to think that children don't become infected with COVID. This is not true. Children become infected and some will be hospitalized. The immunization coverage in this group, the vaccination coverage, remains too low.
The state's health commissioner, Mary Bassett, says children in the 5 boroughs are especially at risk of getting sick. While the number of pediatric hospital admissions have gone up slightly overall, in New York City, child hospitalizations are nearly 5 times higher now than they were at the start of December. And none of the children with severe symptoms were vaccinated, even though kids 5 years old through 11 are eligible to get the shot. At what point will you be really concerned?
I mean, I'm definitely getting concerned. The ERs are starting to get flooded again.
Dr. Ilana Stein is a pediatrician at St. Barnabas Hospital in the Bronx. She says although children tend to do well when they have COVID, some do get very sick and require oxygen and to stay in the ICU. She also says children can have a rare autoimmune response that can happen 2 to 6 weeks after they are infected.
One of the best things to do is for everyone in the household to be vaccinated, especially for the kids who are younger than 5. It's called cocooning. So the more people in the home that you have vaccinated, the less likely that the child is going to be to catch it. In addition, modeling mask behaviors, especially for the younger children.
Governor Hochul says the data is not meant to alarm parents, and so far there are no plans to shut down schools. But the governor says she's monitoring the situation closely.
So there's not going to be one number. It's going to be a combination of events, looking at hospitalization, the rate of spread.
To do that, the state is rolling out 3.5 million COVID tests to its schools, 2 million of them to New York City, the nation's largest public school district.
We understand now the huge costs of having children's education disrupted in terms of their socialization, their mental health, as well as their progression educationally. So the goal is to keep children in school and to do it safely.
Amy Yensi, New York 1.